Next up, let's bring on a panel who's prioritizing health for the mother of the planet, women. And we're discussing the correlation between one's health and financial standings. Because there's no doubt it could be expensive to get some of the health that we require. So let's welcome to the stage Margot Stern, MBA Chief Strategic Officer and ReaGenics, who will be the session's moderator with a few fabulous intellectual professionals from the health industry. Come on down. Prioritizing Health for Women, a prescription for prosperity. Give her a round of applause as she announces her guest.
Here you are.
Thank you so much.
Thank you. Yeah, sure.
Everyone has a mic. Is working, testing?
Yeah.
Yep.
Enjoy.
We're talking, we're a panel. We
Definitely.
have to see each other. Forget that they're there. No, I was just kidding. It's
Good
very
idea.
important that you're all here today. It's very exciting to be here and speak about something that is near and dear to my heart. And I think it's so important not just to women, but mankind, humankind, peoplekind. There are some stereotypes that are going on, and we want to drop those. We will be speaking a little bit about women empowerment under the conception of the title of the panel. But in a women's panel, it's not so often that we see a non-woman on the panel.
Correct.
So we're very, very excited that Tshepang is joining us, and thank you. So first, I just want to start off. So my name is Margot. I am the Chief Strategic Officer of ReaGenics, and there's an element of ReaGenics. We grow plant stem cells in bioreactors. So we grow plants without Mother Earth. We don't have any of the obstacles of Earth. Think outside of the field, right? And know that innovation is bringing us to take all of the ingredients and Mother Nature's gifts and put them inside our medications, our medicines, all of the things that we need to enhance our well-being and bring prosperity. We want to make them low cost. We want to make them available. You're going to hear about from these lovely people how we do that. So please just introduce yourselves and tell us a little bit about what you do, where you're from.
Hi everyone. My name is Asma. I'm a pharmacist, a cosmetologist, a lobbyist, and CEO and founder of SKINIMALIST. Our business is like a baby for us. We are doing our best to provide women with new technologies, services, products impacting their health and their well-being. This is a major part of our strategy, and we aim to change the perception of beauty, skincare, and nutraceuticals within the MEA region. So this is what we do.
Great. Tshepang.
Thank you, Margot. Good day, everyone. My name is Tshepang Mahlangu. I'm a clinical imaging technologist preceptor with Hamad Medical Corporation in collaboration with University of Doha and for Science and Technology in Qatar. And in terms of increasing my knowledge base, I am part of King's College London. And in business, I'm the CEO and co-founder of Money Institute of Biotechnology. And I'm a man of many hats. But I'm very excited to be part of this panel. And yeah, let's go ahead, guys.
Fantastic. So yes, we're not talking about women as baby-making machines. We are more than this. And women's health goes beyond reproduction. There were supposed to be two other women on this panel with us today, and they were the medical doctors. So if you don't mind, I spoke with them yesterday. We were preparing. They're sorry they can't be here. And I would like to read something that Dr. Henna Cuddy said that she felt was important to say on this panel. So she was talking about women's health and equity. And a lack of women's health and equity is actually a lack of equity. Around the world, everyone deserves a fair and just opportunity to achieve, attain, and realize their highest quality of health and well-being. With unique health risks and life experiences, women's diverse needs should be holistically considered. These demands are inclusive of, but broader than material and reproductive care, and include recognition of work-life demands, mental well-being, and preventative health. A global agenda for women's health must therefore have a broadened, redefined focus to encompass not only women's sexual and reproductive health, but also the leading causes of death and disability of women, which actually the leading cause of women's death is heart disease and heart failure. You wouldn't necessarily think about that, and women typically have longer longevity of life than men. So we're here and we have to sustain and keep their impact with us. So for many years, it was widely assumed that the occurrence and outcomes of disease were the same for men and women, and that our understanding of disease processes based on studies involving only men would be equally relevant for women. But an increasing body of evidence suggests that this is not the case, and that we can improve our knowledge about disease occurrence and disease outcomes for both men and women by undertaking analysis of health data disaggregated by sex and informed by a gender perspective, as well as by including sufficient numbers of women in scientific studies. So, Henna, we're sorry that you weren't here today, but now we're going to take the conversation to our expertise. And again, Asma, you started a company to help women make the most of themselves by caring for their well-being. I would like to know what this means and how you believe technology can help accomplish this goal. Maybe ingredients and formulations, these stem cells that my company can do, resveratrol, how it affects the products that we use in our skin. Asma is also a pharmacist, that helps in her knowledge. And preventative efforts, please.
Yeah, sure. So I think that we need to consider beauty, especially now, as a holistic thing for our well-being. It's not about being or feeling beautiful, it's to be able to have a 360 strategy to your wellness journey. And this is what we do. So for example, if you talk about, as you said, about technology and how to prepare the next product for the next generations, I think that we should tackle the technology part by, first of all, thinking about formulations. This is very important. This is something we work on. For example, within SKINIMALIST, we targeted neuro-cosmetics, and I don't know if you heard already about neuro-cosmetics or not, but what we say is that your skin talks to your brain, and this is what neuro-cosmetics is about. So we are not going to formulate products that have X, Y, or Z ingredient, but those ingredients are scientifically proven and they can impact directly your skin and your nervous system. And this is a very challenging thing, and we have been discussing with a lot of manufacturers around the world, and the studies are amazing, targeting especially women's health and women wellness. So I think this is the first part of technology. And the second part, and yesterday I have been part of an amazing panel discussing about cosmetization, and this is something very interesting for the future. And our company works also on that because we believe that we are all different and we need specific products that target specific needs. So you cannot go on the market and start using, we are all different, and you cannot have a product that targets everything and everyone's problems. This is impossible. So in the future, we need to make sure that we formulate products, and we use technology in order to understand what is your needs, what is the why before the how. This is what we were discussing, and this is what we do, yeah. But it's not only about beauty, because in beauty we have, as I said, for the ingredients or for the tech part, but it's also the main important thing is the holistic approach, the in and out beauty. And neuro-cosmetics helps us also for this in and out beauty. So yeah.
Very interesting. Food for thought all day long. Tshepang, so we wanted to talk also about the intersection between technology, innovation, and achieving global health, which is becoming ever so relevant in our world today. Whether it's being able to develop, distribute vaccines, we were in COVID times and still are, times of crisis, finding ways to reach patients, telehealth in remote areas, provide quality care to anyone that needs it. You're passionate about technology, science, and global health. So can you please tell us some next steps for bridging the technology gap, why this should matter even where we are today? So today we're in the UAE, you're from South Africa, I'm from Israel, and as globally to make all of these relevant and active for us.
Thank you very much, Margot, for that question. And coming from a third world country, living in a first world country, developing country, and having worked in the first world countries, I see disparities in health inequalities. And doing research in healthcare sciences, one thing I've realized is health inequities, especially between genders, which for the most part actually shows that women, yes, they do live longer than men, but under which condition? Is their well-being better than that of men or not? Well, one thing we have noticed as we're talking about health tech innovation is the holding of information, especially talking about COVID mRNA vaccines recently between the last 2 to 3 years with the COVID pandemic. We have seen that most third world countries, developing countries, did not receive the necessary vaccines that was required, and this was actually quite a complicated situation regarding IP and manufacturing of these vaccines. And why do we have to bridge these gaps? Well, we have to ask ourselves really fundamental questions as health tech innovators and entrepreneurs, private or public and government, whether what is most important. Is it whether the business or whether it is the human life? And especially when it comes to health. Because while we're sitting here, each and every second somebody's passing away. I met a very interesting character yesterday, not a character but a personality who was part of the panel discussion yesterday and also an awardee for this conference. Her name is Dr. Silvano Micalo. She's from Spain. She wrote a book called Health Tech Innovations. So I asked her, what is your conclusion on the matter? What knowledge, what wisdom would you like to share with me? And she told me one interesting thing. She said to me, the biggest thing she noticed after having to write this book for 6 years is that we have to come to a point where we bridge gaps, which is part of your question. And part of bridging the gaps is we have to be more selfless, thinking about the fact that life is more important than money, and we have to also think about the fact that, you know, health is really not about money, but more about the person. And yeah, that is what I have to say.
Thank you so much. So it's interesting. Of course, health is more important than money. I'm sure everyone in this room is in full agreement with that. But prosperity, right, and a prescription for prosperity, we do have to recognize the size of these markets, right? And the size of the market is a direct correlation to how many people need it, right? So Asma, can you tell us the levels and the financial sides and incredible statistics of what we're looking at in this global industry?
Yeah, so it's actually a very interesting question because we need to visualize what the worth of this market before going into products and going into services or whatever. So for the wellness market is estimated at $1.5 trillion by 2028, which is amazing because here again it shows us how much people are looking for their wellness, and especially after COVID. If we look to all the studies that were conducted, and it's something that you will be probably talking about later on, but if you talk about mental health, for example, which is a very interesting market as well, in part of the wellness journey, we have this study that was conducted by Deloitte, and we see how much the next generation, which is the anxious generation, is going to suffer from all what is happening in the world, and how these elements and these things that happen to us between 2020 and today is dramatically impacting the products that we will be using in the future. So here again, it's not only about, this is what we said, about appearance or about something very specific. It's about a holistic approach, a 360 approach to manage your sleep, to manage your mindfulness, to manage your fitness, your health, your beauty, whatever. But it's part of this well-being journey, wellness journey, and this is why this market is so interesting and so important.
Thank you. I want to briefly also just touch upon, we've been talking a lot about physical health and well-being, but also mental health. We can't not speak about that. So just a moment, Tshepang, I know that you are knowledgeable in mental health, and can you just tell us the difference from mental health in men and women, how you see it? Because what we're talking about is supporting women, but it's important both to talk about the differences and how they're connected and important.
Well, basically, if you think about mental health, we're really talking about psychology. And in this aspect, one thing we have realized in sex differences in psychology is that men tend to be externalizing more of the emotions and feelings, and whereas women tend to be more internalizing of the emotions and feelings. What this actually means is women are more predisposed to neuroticism. What that actually means in a deeper level is that women tend to be experiencing more feelings of anxiety, depression, and irrational fears. And this is when we look at history and society and all the mechanisms that actually contribute to how our society is today is based on how we treat our women. And this is actually something that has to change, and what we also impose on them in terms of psychologically, physically, financially, also within the spaces in which we exist. And what I mean by that is we have to take off some burden as also some responsibility of them, so that they can be more empowered to be able to focus on what actually benefits them, to be able to be more prosperous and contribute to society. And in terms of men, what we see is with the externalization is substance abuse, more aggressive behavior, and antisocialness, which explains why we cannot get a lot of business cards from men. I'm kidding. But with that said, what I mean is we see a lot of men spending a lot of time in sports bars and then at home with their kids and their families. And also what we see is violence between men is more than between women, and also domestic abuse with the COVID pandemic was high, which was indicated in studies. And this is very concerning about psychology and mental health. And so dealing with this is a very, very important issue in terms of how we empower our women to be able to move on forward, in terms of also how we view them. We should stop objectifying women and start to see them as our equals in society and treat them fairly and equally and give them that opportunity to prosper. And I think this is what I have to say. Thank you.
Thank you. Okay, so Asma, tell us how in your field, cosmetics, cosmeceuticals, and nutraceuticals can empower women.
Here again, it's a very interesting question, because we saw how much, and this is what we were discussing, the holistic approach, the 360 approach. This is the main thing here regarding beauty and wellness. And when we talk about nutraceuticals, we see how much we are using them today, and at every stage of our life, actually. So it becomes part of our wellness journey, and we saw the shift from the curation to the prevention, and people would like to take care of their own health, and especially after COVID. Now we would like to take care of ourselves. We would like to take care of our health, to understand what is happening in our bodies. The future generations are so educated, and they want to know more about their health. So with those products, which are over-the-counter products, we see that we need to provide the next generations with the right products, and those products will empower them via their well-being, because they will feel better and manage their health better. And I think it would be a very interesting thing for the future. But at the same time, as we discussed yesterday at the panel, we need to come up with new ingredients, new products, and it's innovation. And innovation in nutraceuticals is not something that's easy, especially with all the regulations that we have internationally. You were talking about cosmeceuticals. I love this word. I have a brand, and this is why it's about cosmeceuticals. But you know the problems that we're facing regarding the regulation of cosmeceuticals, because we need to do more research and more discussions with governments to accept this word and to go beyond the beauty and go for the in and out beauty, and thus have this crucial impact on health. So yeah.
Amazing. So my company, ReaGenics, we use stem cells, and we're trying to figure all of this out. Let's do it together.
Exactly.
Good? Okay, excellent. So we only have another minute before we take some questions. Tshepang, just quickly tell us, what do you think is the most pressing issue today in women's health, and how companies like yours and data and innovation can do just one thing, pressing issue, and what we should do first?
Yeah, well, just to round it off quickly, we have seen that data collection research has actually contributed significantly to innovation and how products are developed. And she mentioned what is the most pressing issue to women's health today. And without the data and the research, we wouldn't have known that heart disease and breast cancer were the leading cause of death in women. And currently, me and my company, which is Mani Institute of Biotechnology, we went into seeking out an issue which affects women, which is called endometriosis, which has no diagnostic test available that can actually give results promptly, except when results start showing or when symptoms start being noticed in women. And we have developed the endometriosis DNA probe. We are in the clinical stage right now, and it has shown 98% diagnostic accuracy. And yeah, we've very much invested in women's health in that regard. Thank you.
Thank you so much for your work. So our time is up for this panel, but I know we need to ask questions, so we'll open for questions, right?
Hello, hello. So we do have, our time has come up. We got a couple more people coming up. So I want to give time for people to engage. If you have any questions around women's health, if you think this is something important and relevant to you you'd like to bring up, I invite you to please come up to the microphone. Don't all run at the same time. I know after lunch people get a little lethargic. You know, we get tired. There was rice, lots of carbs on that table, that buffet. Okay, then this is what I'd like to do, is thank these wonderful panelists. You've done a great job on the stage and keeping us engaged. Thank you for all the people on YouTube watching. Give them a round of applause, please. Sorry we don't have any questions, but I'm sure there are a lot of people still outside engaging and talking. There's no doubt that sometimes by day 3, people are having such a good time that they go out and they're just chatting away, you know? But have you had a good time? That's all that matters.
Amazing.
That's all that matters. Come on up here to the front of the stage. We ask you for a group photo. That would be great. Babu takes a great shot. Now I'm just going to ask again, is everyone getting what they need from this event, connecting? I see some new faces I haven't seen before. All right, thank you guys. Thank you, Margot, so much for hosting and moderating this session. Was there someone in the back there? I know I saw them before. These lights are very bright. That wanted to get some more connections here. All right, looks like everyone's happy. You're making enough connections. You're meeting enough people.